Hello everyone, this is your dietitian Ayesha Siddiqa, and today we are going to discuss in detail about IUI, its treatment, procedure, risk factors, infection chances and success rate. So before any further delay, let's start the video. So the question arises here, what is IUI? It is basically the abbreviation of intrauterine insemination, a type of artificial insemination. It's a kind of procedure for treating infertility. Sperm that have been washed and concentrated are placed directly into your uterus around the time when your ovary releases one or more egg to be fertilized. The hope for outcome of intrauterine insemination is for the sperm to swim into the fallopian tube and fertilize a waiting egg, resulting in pregnancy. Depending on the reason for infertility, IUI can be coordinated with your normal cycle or with fertility medication. Here I have given some reasons that why you can use IUI as a procedure for infertility. The first one is donor sperm. For women who need to use donor sperm to get pregnant, IUI is the most commonly used to achieve pregnancy. Frozen donor sperm specimens are obtained from the certified lab and thawed before the IUI procedure. The second one is endometriosis related infertility. This is a kind of infertility related to endometriosis. Using medication to obtain a good quality egg along with performing IUI is often the first treatment approach. The third one is mild male factor infertility, subfertility. Your partner's semen analysis, one of the first steps in the medical assessment of infertility, may show below average sperm concentration, weak movement of the sperm, or abnormality in the sperm size and shape. IUI can overcome some of these problems because preparing sperm for the procedure helps separate high motile and normal sperm from those of the lower quality sperm. The next one is the cervical factor infertility. Your cervix at the lower end of the uterus provide the opening between your vagina and the uterus. Mucus produced by the cervix around the time of ovulation provide the ideal environment for sperm to travel from the vagina to the fallopian tube. But if your cervical mucus is too thick, it may impede the sperm journey. The cervix itself may also prevent sperm from reaching the egg. Scarring, such as the caused by a biopsy or other procedures, can cause the cervix to thicken. IUI bypass your cervix, depositing sperm directly into your uterus and increase the number of the sperm available to meet the awaiting egg. The next one is ovulatory factor infertility. IUI may also be performed for women who have infertility caused by problem with ovulation, including an absence of ovulation or reduced number of eggs. The last one is semen allergy. Rarely an allergy to protein in the sperm in the semen can cause infertility. Ejaculation into the vagina causes redness, burning and swelling where the semen contacts the skin. It can protect you from symptoms, but it also prevents pregnancy. If your sensitivity is severe, IUI can be effective since many of these proteins in semen are removed before the sperm is inserted. Now we are going to discuss about some risk factors of IUI procedure. The first one is infection. There is a slight risk of developing an infection as a result of this procedure. The second one is spotting. Sometimes the process of placing the catheter in the uterus causes a small amount of vaginal bleeding. This doesn't usually have an effect on the chance of pregnancy. The third one is multiple pregnancy. IUI itself isn't associated with an increased risk of multiple pregnancy, twins, triplet or more, but when coordinated with ovulation-inducing medicines, the risk of the multiple pregnancy increases significantly. Multiple pregnancy has higher risk than a single pregnancy does, including early labor and low birth weight. Now we are going to discuss about the procedure of IUI, that how your health practitioner will perform this procedure. It has simple 3 steps. Number 1 is preparing the semen sample. Second one is monitoring for ovulation, and the third one is determining an optimal timing. First one is preparing the semen sample. Your partner provide a semen sample at the doctor's office, or a vial of the frozen donor sperm can be thawed and prepared, because non-sperm element in the semen can cause reaction in the woman's body that interfere with fertilization. The sample will be washed in such a way that separates the highly active normal sperm from a lower quality sperm and other elements, and the likelihood of achieving pregnancy increase by using a small, highly concentrated sample of the healthy sperm. The second one is monitoring for ovulation, because the time of IUI is crucial, and monitoring for the sign of impending ovulation is crucial. To do this, you might use at home a urine ovulation predictor kit that detects when your body produces a surge or release of the luteinizing hormone, or an imaging method that lets your doctor visualize your ovaries and egg growth. That process is transvaginal ultrasound that can be performed. You may also go for injection of the human chorionic gonadotropin on medication to make you ovulate one or more eggs at the right time. The last one is determining optimal time. Most IUIs are done a day or two after you're detecting ovulation. Your doctor or other healthcare provider will have a plan spelled out for the timing of your procedure and what to expect. And now we are going to discuss about the result. I think so you have to wait for 2 weeks before taking an at-home pregnancy test. Testing too soon could produce a result that is a false negative or false positive result. Now I'm going to tell you about how this kind of results can be produced. False negative. If your pregnancy hormones are not yet at measurable level, the test result may be negative when in fact you are really pregnant. And second chance can be false positive if you are using ovulation inducing medication like HCG, the medication that's still circulating into your body and could indicate a pregnancy when you really are not pregnant. Your doctor may instruct you to return about 2 weeks after your home kit result for a blood test, which is more sensitive in detecting pregnancy hormone after fertilization. If you don't become pregnant, you might try IUI again before moving on to other fertility treatments. Often the same therapy is used for 3 to 6 months to maximize the chances of pregnancy. This is all about today's video, and thank you so much. We'll see you in the next video.